Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Today, we have a special sponsored episode about how ambient clinical intelligence can improve patient care and reduce clinician burnout. It's brought to you by the Dragon Ambient Experience, or DAX for short, an innovative ambient clinical intelligence solution from Nuance Communications and Microsoft. Find out more at nuance.com/explore DAX. That's nuance.com/EXPLOREDAX.com. Today I'm joined by Alfred Atanda Jr. He's a pediatric orthopedic surgeon at Nemours Children's Health in Delaware, where he serves as the chief of the Center for Sports Medicine, the chief of clinician experience, and is also an assistant professor of orthopedic surgery at the Sidney Kimmel Medical College at Thomas Jefferson University. Alfred, welcome to the show.
Thanks, Kevin. Thanks for having me. Much appreciated.
So let's start by telling our viewers a little bit about you. Please share your story and journey to where you are today.
Yeah, so actually my family is originally from Ghana, but I was born and raised in South Jersey, educated on the East Coast, and eventually became an orthopedic surgeon at Nemours, where it's my only job. And, I was a sports medicine surgeon doing the regular stuff that we do. But I kind of fell into this new role, an administrative part-time role with physician and clinician well-being. And that's really kind of taken over a lot of my time, my non-clinical time anyway. So it has been a long path. So I was on the regular straight and narrow path like every other doc, but kind of pivoted and changed gears a little bit into what I'm doing now with physician well-being.
All right. So many hospitals, as you know, are focusing more on physician well-being. From your perspective as a physician, what are some of the causes of declining physician well-being?
Yeah, I mean, it's multifactorial, but I think the underlying problem is, a lot of us physicians have kind of in our hearts and our bellies what really drives us into healthcare. I always give this example of, when I was a kid, I really liked Starbursts. I always loved purple, pink, and red Starbursts, but I always hated the orange and yellow ones. So over time, the orange and yellow ones would build up and nobody wants them. And it's kind of like that, for me, I like bonding and connecting with patients. I like providing care. I like kind of interfacing cutting edge technology as a surgeon. But there's a whole host of other things that I wasn't quite aware of when I was training, but they really kind of take over your life in terms of compliance and legal and privacy and HIPAA. And I think, just at a high level, like so many of us physicians spend so much of our time doing other things that is not of true value to us. And you have to make money and you have to have a family and live your life and stay healthy and do all the things. And over time, it erodes you little by little. And I think that's kind of the core essence of what we're dealing with. Obviously, it's not a simple problem, but I think, that's just kind of the main issue that most physicians are dealing with these days as it relates to burnout and well-being.
Now, you mentioned as part of your story, you spent a lot of your administrative time trying to improve clinician well-being. Now, what
Mhm.
challenges do you plan to address, and how do you hope to improve physician well-being within your community?
Yeah, so the biggest thing I would say that we face as a barrier is culture. As you know, the culture of healthcare, specifically academic medicine, has been one where we provide for patients and we make money. And that's what the system is designed to do. It's not necessarily designed to take care of us. So, changing the model and the paradigm of how we look at how hospitals function to integrate and incorporate taking care of the people who are the frontline providers doing the work is going to be a challenge because that's been ingrained in all of our DNA for decades, basically. And I think chipping away at that culture is going to be first and foremost the biggest issue. Secondly, how do we show that taking care of the people that are doing the work is of value financially? So showing that kind of return on investment and return on value is going to be key because it's very easy to say, okay, well, if I feel good, I'm going to be a better doctor, quote unquote. But the proof is always in the pudding. So that's something that, with a lot of our projects and our endeavors, we're always looking at metrics and, are we saving time? Are we allowing physicians to see more patients with some of these projects? Are we allowing, physicians to take better care of these patients? And we want to have objective data to show that. So basically, cultural change and showing how this can be of financial value to larger healthcare ecosystems is going to be a huge challenge, but it's an exciting challenge nonetheless.
Can you tell us a story or a case study where you've moved the needle or you've had a success or a win when it comes to changing that culture or having the systems recognize the value of tackling clinician burnout?
Yeah, for sure. At our hospital, as in with many hospitals, we have kind of an on-call service where, as a specialist community, physicians and PCPs and urgent cares can get a hold of a specialist who's on call. And for us, it's called the physician priority line. So outside physicians can call in. And when it was devised probably 10 years ago by somebody who doesn't even work at our institution anymore, the goal was to just provide access to the folks in the community and to help generate revenue. And, as a specialist being on call, I'm operating, I'm seeing my own patients, and I'm getting all these phone calls and all these other things. So we try to, if we start to take a deep dive into like, okay, what actually happens with this PPL line is what we call it. And what we found is that we started investigating and kind of peeling away the onion is that in actuality, a lot of the calls we were receiving weren't from other physicians. They weren't physician related problems. They took up an exorbitant amount of time just to gather the information and connect with them and call them back. But most importantly, around 5% of the time, it was actually resulting in a new appointment to our system. And I think this was really eye opening because, in large academic healthcare systems and even private ones, there's so many initiatives that, somebody thinks is a good idea and we do it and they just thrust it upon the physicians and everybody just falls in line and does it. And then 8 years later, you look back, you don't even know why you're doing it. You don't know if it's beneficial. So I think these kind of early wins of being able to say, listen, we've been doing this, but let's kind of revisit it once a quarter or once a year, or what have you, to ensure that it's still providing value, to ensure it's not too burdensome. That was a very big early win for us. And as you can imagine, there's hundreds of those sorts of examples that are very rampant in healthcare today.
Well, as you know, with so many demands on their time, physicians today report record levels of burnout, and that jeopardizes their well-being. Burnout is caused by many factors, one of which, of course, we're going to talk about today, is clinical documentation. Studies indicate physicians spend 2 hours documenting care for every hour spent with patients. Alfred, have you and your colleagues experienced burnout because of administrative burdens like clinical documentation? And if yes, tell us about that experience.
Yeah, I mean, you kind of hit the nail on the head. It's kind of a direct correlate. And as I was talking about, a lot of those extraneous external things outside of providing clinical care that we have to deal with, I would say number one is documentation. And, it's interesting because in most, facets in our life, when you give money to get some product or some service, you usually get the product right then and there. For us, as in healthcare, you see a patient kind of go through the treatment algorithm, they leave your office, and you don't get paid till however many weeks
Yep.
later until you document, right? So documentation, as you know, is of no value to your average physician. It's just that they have to do it in order to get paid. So we want to find a way to kind of blend and meld with what you're actually doing that provides value and joy to you with what you're getting compensated for. And right now, to see a patient in the office, in a pediatric setting and really connect with a youth athlete and help them through that injury that they're dealing with, get them on the path to recovery, I don't get paid for that. I get paid to do the note. And as you know, that note takes time.
Sure.
It's tedious. So yeah, that's what we've kind of unpeeled to really learn how documentation is directly correlated to burnout in large healthcare settings.
Now, let's talk about the impact of documentation on patients. Do documentation requirements, do they negatively impact patients? And can you share a story or a case study that would illustrate that impact?
Yeah, I don't know exactly where this picture is from, but there's definitely something I've seen at well-being conferences. A little girl, she's like 6 or 7 years old, and she was asked to draw a picture of her doctor. And what she drew was her and her mom in the doctor's office, and the doctor was had their backs to them and was typing. And that's really eye-opening because that's what it turns into. A lot of folks, specifically in the primary care family practice realm, where some of these notes are really long, in order to save time, you see the patient and evaluate them while you're documenting. And as you know, not all of us can look at a patient and then type in an EMR without looking at the screen. So what invariably happens is you're like, nodding, and you're typing away, and the patient in that interaction and that bond suffers. And again, it's hard to quantify that, into what it actually translates into. But I really do think for a lot of specialties and a lot of different types of doctors, they're so overwhelmed and so burdened that majority of their face-to-face interactions with patients, unfortunately, is spent looking at a screen. And if you've been to the doctor recently, we're human beings. We thrive on connection and bonding to other human beings, and the ties that bind us together are so strong. And unfortunately, a lot of times our attention is deviated away to other things that are of no value to the patient. So that's definitely something that has come up in the past few years in my role here.
So talk about your personal journey with the various clinical documentation tools that are out there. What have you used in the past and what are you using today?
Yeah, so when I first started my practice 12 years ago, every documentation was either just typing into Epic or would dictate into a phone, and somebody would listen to that dictation and type it. Then it graduated to an app where you would have an app on your phone, and then you would talk into it, and then same thing, a human being would listen and type it, but they would type exactly like what they thought you were saying. And then came along Dragon, also from Nuance, where you in real time talk into your phone and it shows up onto the screen. But again, that's just talking exactly what you're saying word for word. Obviously some people use scribes and different things, which we've tried at our institution. And kind of the most recent stop on our journey, which I'm sure we'll talk about later in the episode, is DAX, or just Dragon Ambient Experience software, where it really kind of allows me to talk to a patient in real time in a normal setting, bond with them, connect with them, get whatever information I need from them, convey whatever information I need to them, all the while the note is being generated simultaneously in the background. And I think it's really come a long way in terms of this journey and timeline of documentation in recent years.
So we are going to talk about the DAX system. So this episode is brought to you by the Dragon Ambient Experience, or DAX for short. It's an innovative ambient clinical intelligence solution from Nuance and Microsoft. Find out more at nuance.com/explore DAX. That's nuance.com/EXPLOREDAX.com. So Alfred, before DAX, what other challenges was your organization experiencing that made you consider ambient clinical intelligence?
Yeah, I think one of the main problems before DAX is that you couldn't always document in real time as you were doing work with the patient unless you wanted the patient visit to suffer. So what a lot of us do is that we see our patient, we give them our undivided attention, but then you have to get up and leave and then go document. And that's kind of what I was alluding to before. The patient has now left.
Yeah.
The value has now been bestowed upon them and they feel better about their issue. But in order to be reimbursed, now you have to sit down and document and sift through the EHR and all that other stuff. And that kind of sequential way of documentation is very inefficient, right? Because why isn't there a way that I can provide value and document in real time? And I think that's kind of the problem that the DAX solution was bringing. And for years, we were seeing patients and documenting, so we were just very inefficient, kind of muddling through the clinical workflow.
Now, for those who may not be familiar with ambient clinical intelligence, can you explain what DAX does and how you use DAX in your clinical workflow? Again, can you share maybe a story or a case study that would really illustrate that workflow?
Yeah, it's very interesting. I'm not a chief technology officer or anything, but my basic understanding of it is that it uses AI-driven software in conjunction with a real person to learn and get smarter over time as to kind of how you practice and how you talk and what your workflows are. And you embed a little bit of your own templates into that they serve as a structure. And then basically it's ambient experience. So it's enabled to capture the voices of the people in the room. It's basically able to filter out, babies crying and sirens going off. If you talk about extraneous stuff like sports and politics, it doesn't include that in the note. It's really able to extract what's the key clinical valuable information from that ambient experience and put it into a note in the template and form that you prefer. So it's not going to just make a note for you. You kind of have to guide it a little bit. So upfront, you do a little bit of work embedding some of those templates into the software, and the DAX people help you do all of that, and then it comes out in the way that you like. And one of the things that I've really liked about DAX, and I don't have a specific case, but in general, it's actually helped me with education of trainees a little bit more. That's a very unexpected benefit. So most of the time when a trainee goes in, they go into the room, they talk to the patient, they come out, they present to me, I talk it over with them, and I go back in the room. So now what we do is when they come out and present to me, then I hit record on DAX. So you don't actually have to be in the patient's room. It just records whatever discussion is occurring. So now the trainee comes out, tells me the story, I interpret images or x-rays with them, teach them, all the while DAX is capturing that. Then we go back into the room, finish up with the family. And then when we're done, the documentation's over. Normally the trainee would then have to go sit at the computer and type really quickly. I'd be annoyed because I have to wait for them before I can go see the next patient. Or they would just say all their notes to the end of the clinic and they'd stay there an extra hour doing them. So now all of that is mitigated and reduced, which I actually wasn't expecting that, but that's a really key benefit in terms of, for those of us that work in academic settings, that you can incorporate trainees and scribes and MAs right into that very seamlessly.
And is that note created? Is it pretty much instantaneous?
So at first, it takes a bit of time as it gets to learn kind of your system and your style. It takes about 2 to 3 hours as you set off your initial journey working with DAX. But now, sometimes it's up to 30 minutes where I'll just, keep seeing patients and then the note will pop in. Just like if I documented into it, then you can go in and edit it and do whatever you need to do. So it gets quicker, faster, and learns just like any other, AI-enabled software technology.
So what about that editing process? Because sometimes with other transcription services, you have to go over the note and edit it. What's it like with DAX?
It's like I said initially, there's some hiccups as the AI learns your techniques. I've been doing it since April of 2022, so it's been a while. So the editing is very minimal. If for whatever reason something was muffled or like the phone was, far away from whoever was talking, then you may have to add a couple of things. But I would say in general, for a note generated by DAX, I would spend less than a minute kind of just glancing over it and just adding on it. If they don't get something, they put an asterisk and fill it in. But yeah, it's very minimal editing, to be honest with you.
So you mentioned the effects of DAX on your trainees or people who are rotating through and it helps from an educational standpoint. How about other members of your care team? How has the impact of DAX affected other members of your care team?
Yeah, so as a sports medicine surgeon, I work with athletic trainers, and these are master's level individuals who are really my eyes and ears throughout the clinic and serve as the quarterback of really running clinic. But a lot of their time and their burden is also with documentation, right? They kind of serve as scribes, they follow me around, typing notes and such, but that's not of any value to them. And they're not valuable to me if they're spending their time and their energy just typing what I'm saying. So when I go into a room now, I can take DAX with me, and then my athletic trainer can go see another patient, or she can call a mom back with MRI results, or she can look at a patient in tomorrow's clinic and make sure they have the appropriate scripts before they come in. Those are things that are of true value to me as an orthopedic surgeon. So DAX allows all members of my team to now do things that I find valuable as opposed to spending an inordinate amount of time following me around writing the words that I say. And that helps them because that's very tedious and burdensome to them as well. And it gives them a little bit more entitlement and empowerment to do things that they find more, relevant and clinically valuable.
How about the impact on DAX on patients? How does it positively impact patients and their experiences at your facility?
Yeah, as we alluded to earlier in the episode, I think it allows, first of all, I'm in a pediatric place, so all the kids think it's cool. When I tell them I have this app and I'm like, hey, don't mind me, it's just gonna, eavesdrop and type our note. But in all seriousness, I think they enjoy it because they have my undivided attention. I don't have to be looking in the Epic or the EHR, or I used to be scribbling notes and writing things down so I can go out and then dictate. I literally sit there and look at them and talk to them and ask them, how their soccer game went or how the homecoming dance was or how the weather is for them, anything where I can just be relaxed, and not have in the back of my mind, okay, hurry up, I gotta go dictate, I gotta go do this. Like it
Mm.
it just changes the overall kind of vibe of the clinic visit. And I feel a lot less stressed. So I'm assuming that kind of transfers to them and allows them to be a bit more relaxed too, because they're at the doctor. They have some anxiety inducing problem with their knee or their ankle or whatever. The last thing they need is to have me on edge or have me trying to rush out of the room because I have my own responsibilities to do.
Now, some physicians might be hesitant to adopt new technologies. And in your opinion, what causes some of this hesitation?
Yeah, I mean, physicians are creatures of habit. We have our workflow, especially older ones. We've been doing the same things, for many years, and it gets us from point A to point B. It allows us to do our job and go home and live our lives. And that's at the end of the day what we all want to do. And I think, specifically in some larger healthcare ecosystems, whenever something new is kind of introduced, it's invariably something A, that we don't care too much about. B, it's for some reason or some external regulatory endeavor that we don't even understand. But most importantly, the third thing is that invariably just makes our jobs harder. And when you get an email blast from the CMO or the physician in chief about some new endeavor, you're like, oh my God, all right, fine, but us, we're
Yeah.
resilient, we're gritty, we've been in the trenches since day one. There's nothing you can throw at us that we can't handle. We roll up our sleeves, we get to work, and we get it done. But that's a very kind of adversarial relationship with administration, which is another huge part of burnout and lack of well-being. So I think, yeah, for something like this, if you don't do it appropriately, it's going to fail before it even begins. And what Nemours has done, which is great, is they've really worked with about 20 to 25 kind of go-getter, innovator, early adopter type docs, younger docs, people like myself, who are willing to just kind of try things out and see what's going on. We did that for a good, I did it for about 7 months. Some people did it for about a year. Then we kind of compiled all our data. We looked at patient satisfaction scores. We looked at timing and the EHR and documentation. And we were able to present this to the physicians in a very collegial way. Like, this isn't coming from administration. This is being supported by administration, but it's coming from us, your fellow doctors. Like, this was my experience. This is how I did it. This is what I troubleshooted. This is how I got better doing it. And that inspires, buy-in, and people like, huh, well, if Al was able to do it, maybe I should try that. But I think a lot of organizations mean well with things like DAX, but you have to be very careful about how you roll it out, because if you don't really sell it appropriately to the physicians that they think and realize it'll be something that is to benefit them and how they provide care, everybody just shuts down and nobody wants to do it.
Now, the introduction of DAX, was that administrative driven or was that driven by clinicians?
It was a little bit of both,
Mm.
actually. So obviously, our CMIO, who's an administrator, was interfacing at a high level with Nuance of how to bring that to our system. But one of the beauties of what we've been trying to do in physician well-being in our hospital is bring physicians and the appropriate stakeholders to those decisions early and often, right? You don't bring some vendor or some company in, and then a year and a half later, when you've spent, $600,000 and all of these hours implementing it and getting it to a perfect point, then you bring in doctors, because what if they don't like
Yeah.
it, or what if it doesn't work, or what if it doesn't do what you need it to do? And the smart things that Nemours did was bring, our chief wellness officer, who's a physician, and myself and other appropriate stakeholders right up front. Like, okay, this is how we're going to roll it out stepwise. These are the early adopters we're going to reach out to, always kind of ingraining the message of this is for the physicians, to benefit them, to benefit their patients. It does happen to be a new initiative. It does happen to be provided by a vendor. It does cost money, but having those conversations, and it's, you have this bad pill that you have to swallow, but you put it in ice cream or yogurt or something that tastes good. If you kind of mesh it all together, it's palatable and people embrace it, but you're still getting the appropriate message to wherever it needs to go. And I think that's really the underpinning of physician well-being these days.
So obviously you've had a positive experience when it comes to implementing DAX. Now, what about the
Mm-hmm.
other clinicians in your system? What were those first few months like as it took them to ramp up to the AI and get DAX to
Mm-hmm.
learn to their practice styles? What was it like for them?
Yeah, I mean, it definitely has its hiccups. It's definitely not perfect. You do have to put in a little bit of work up front to ensure that you get a good product. And I think we set ourselves up for success in the sense that we picked physicians who are willing to do that.
Mm.
And we picked physicians who know that's what they're going to have to do. If you just kind of sell it to somebody, hey, try this new ambient experience thing, it'll be great. And then the second they have one or two hiccups, that's it. They're not
Yeah.
doing it anymore. So yeah, there were issues, but we were well aware of that. The DAX people were very transparent that, at first the notes are going to take several hours. At first, the notes are going to need you to put a lot of editing time and input information so it can learn from you. And that transparency and that collegiality made some of those hiccups and those kind of technological shortcomings not so unpalatable, to be honest with you. But yeah, I always sell that to people and help them understand that it is going to be a little bit of a work in progress.
And is DAX implemented system wide in Numerous?
Yeah, we just started in January. The CMIO is working out all the details, but that's the goal for 2023, that any physician that would like to try it will have the opportunity to do so.
And it's probably too early for data when it comes to well-being, but just anecdotally, what have you heard from your colleagues who've been using DAX in terms of how it affects their well-being?
Yeah, I mean, I think I would say this. I wouldn't say DAX in and of itself improves your well-being. What I would say is that having an armamentarium of clinical documentation tools at your
Mhm.
disposal to use in an autonomous way when you need it for which particular clinical scenario is what's most beneficial for physicians. You don't have one, screwdriver to build a house. You have all kinds of tools. DAX is just one of them. I do think DAX is a little bit of a game changer, and it's a lot more, further along than some of the other documentation tools we have, and also looking at scribes and other things. But I think just knowing that the organization is committed to helping us relieve this necessary burden and giving us tools that we can use to get through it, I think that's what the true essence of the improvement of well-being is. Obviously, DAX is great, and I personally like it, and I do like having it in my toolbox. But I think what it signifies is even bigger than just an app that helps you do your notes.
And my final question, Alfred, what are some of your take-home messages that you like to share with the Kevin MD audience?
Yeah, I mean, I think, as an innovator and a pioneer myself, I think you have to be able to embrace new technology and new tools and new solutions. I think we do get very kind of entrenched and ingrained in our ways. But in order to really grow personally and professionally as physicians, you do have to be able to kind of embrace new things that make you a little bit uncomfortable. And that's the only way that you can kind of progress. And secondly, in the vein of physician well-being and burnout, obviously documentation is just one part of it. The true benefit that you're going to get from any endeavor or any project that you want to bring to light, this is mostly for any administrators that may be listening, is that it has to be a systems level approach to well-being. The old adage of, oh, you have to be stronger, you have to be more resilient, you need to go see a therapist or do yoga or take care of yourself so you can work in this chaotic, fragmented, not so efficient environment. That's not going to work. The idea has to be at a systems level, organization wide approach to improve the environment such that these great physicians who are doing the work that brings them value and joy can thrive and grow and do what they need to do. And that's something, again, that I've learned in the past 3 years in my role. And, there are a lot of challenges ahead, as we discussed earlier, but I think we're moving the needle in the right direction. And I think it's providing a lot of hope for a lot of physicians out there.
Well, thank you so much for sharing your time and insight, Alfred. You've been listening
Sure.
to today's special sponsored episode about how ambient clinical intelligence can improve patient care and reduce clinician burnout, brought to you by the Dragon Ambient Experience, or DAX for short, an innovative ambient clinical intelligence solution from Nuance Communications and Microsoft. Find out more at nuance.com/explore DAX. That's nuance.com/EXPLOREDAX.com. Thank you so much for listening.